So I wanted to talk about, so some of this stuff is fairly obvious, but this is kind of, I suppose, the discussion I've been having with a few people, so it's good for me to practice saying out loud to people who also know lots of this stuff. So at the moment, when we look at coronavirus, if you zoom out, let's talk in the press, and most of the focus is on the scientists and on national governments. Okay, so when a pandemic starts, and we've got the World Health Organization, loads of national governments, loads of scientists working on bits and pieces. Then in national government, we've got places, we've got DWP doing their stuff, we've got Treasury doing their stuff, supporting individuals and businesses. We've got NHS and all of its DHSC, Department of Health and Social Care, and all of its various sub-bodies like NHSX, NHS Digital, Public Health England, etc., doing lots of stuff. Now, there's also local places doing stuff. So when I look at myself, I live in, for those who don't know, I live by the sea, and I'm very happy about living by the sea. So I live in Whitley Bay. And in Whitley Bay, if I was short of food because I was isolating, the food bank, Whitley Bay Food Bank, will be dropping food around my door. I might be contacting VODA, the North Tyneside Volunteering Service, because they're the one who are organising most of the volunteering in the area, not the NHS Volunteer Service. It's VODA doing it, who work with the council, work with the food bank, work with the local health trust. The local coppers come along, and they're the ones who clear me off from the seafront if I happen to sit down and start reading a book. Because at the moment they say, please don't sit down and read a book, mate, move along, keep moving. It's the mutual aid group in my street who are helping people who don't want to go to the volunteering service or the council or the coppers. So most of that stuff is happening at local places. And as we're moving to this point where we're starting to relax the lockdown, more things happen at local places. So that local authority starts to say, and this is happening across the country, how do I stop a potential outbreak before it gets too far? How do I help businesses who've been closed down? How do I help them get restarted? How do I help people who've been furloughed? How do I help all of those different bits and pieces? Local authorities play more of a role at this stage of the pandemic than they've done in the past. And to do that, those local places are looking for information. So, as a local authority, they want to know how can they detect if there's a potential outbreak in their area so they can try and stop it. The ways they might stop it, when you talk with them, as I have been doing, they might say, if we think there's an outbreak in this tower block, we might stick some hand sanitizer at the bottom. We might put some posters up reminding people to wash their hands. If we know which businesses are receiving financial support right now and when it's going to get cut off, we can get in touch with them if they're critical and start to see if they need help. Or we can tailor our service so businesses can contact us. We can put out the right messaging for them. Food banks and volunteering services want to know where people are isolating so they can optimize their things. If the number of people isolating is shooting up, then the food banks might want to get on the phone to where they get their food from, which is from individuals and from nice places like Morrison's and Greggs, who are really good suppliers to food banks in this area, and say, can we get a bit more food in because we've got a lot more demand at the moment. But at the moment, all of that information that could help inform that is flowing up into the centre in a one-way fashion. It's not coming back out in a granular enough level to help inform those decisions. So, local authorities, they're actually starting to do, when you chat with them, they're starting to do things like, so one local authority last week, who I'm not naming publicly because they haven't said, please name us publicly, was saying they've been talking with various authorities in their area about launching their own symptom tracking app, because the symptom data that's available isn't good enough to actually help them spot outbreaks. And that's them, their public health, they're working with their public health authorities, they're working with their local hospitals, but the data's not timely enough from there. The symptom tracking data that's coming out from central government is at too high a level. So NHS Digital publish it at clinical commissioning group level. Project Oasis thing, which is pulling together all of the symptom tracking apps, doesn't publish anything at all at the moment. And no one knows where that, I can't quite find out where that's going. So they're saying, we might have to build our own thing to start to do this. They might even One place is talking about doing a great vinegar test of getting all the population to sniff a bottle of vinegar and see if they've still got a sense of smell, and use that to spot to see if they've got any outbreaks and where they might be. Bit whiffy, but these are the things they go to. Testing data again isn't coming back at all. It's coming out at a high level region, and the national debate is driving it more towards data which is useful for public information and the national media. I'm glad that Mark loves vinegar. The person I'm very nice, and a nice little premium balsamic vinegar on my salad when I have salad, which is very rare. As anyone who's met me can tell, I won't get distracted like I always do. So the testing data isn't coming out at the right level. Similarly, GPs don't actually know if patients on their books have been tested and what the results are, because the data is not flowing through at that granular level, because local authorities have checked with their GPs and said, the NHS ain't giving us this data, can you? And the GP saying, we haven't got it either. But because it's not flowing through at that level, when it does come out, it's likely to be the next release is going to be at the national level, because it's being dominated by political complaints about volumes of tests, etc., etc. When local authorities say, if we knew 2 people had tested positive in a tower block, we might, take some action on top of that. There's also one way. We need to chat around on the concerns, and I've got a few calls in the diary with various people to start unpicking this. So you see that political concern, and that political debate that's happening around some of the data. There's a privacy concern. Some of the debate about privacy has gone, and one of my facets is being a privacy activist. It's gone way too far into privacy concerns. Lots of debates in the UK, and government are responding to that. So when you talk to people in government, they do seem to be prioritising privacy above public health in some places. That can be a bit of a concern. I wouldn't say privacy schmivacy, but there's ways to balance these things, and there's ways to address these concerns. The priorities, central government, there's a lot of civil servants who are working flat out and trying to prioritise local needs against the needs of the national needs is hard. The pressure people are under, people have been working flat out for months in central government, and I'm incredibly conscious of, and central and local government, I'm incredibly conscious of the pressures some people are under in trying to do that. And then processes. So I managed to find an email address that you can request data from the COVID-19 data store, which is mostly in the press as the Palantir faculty data store, but it's where NHS is shoving lots and lots of data and doing lots of models and dashboards for the centre. I found an email address to request access. I got sent back a 15-page form, which was version 13 of the form. I got sent a system to sign up to, which requires NHS email addresses. I was told even if I was given access, or anybody else was given access, all that would be provided was a dashboard, and that no one would be able to download data from the dashboard. Because that's somehow where things have ended up around that space because of all these other pressures. And unpicking some of that is going to be tricky and sensitive and all those kind of things. And if we were to get some of that data, we've got to be realistic, but just secure. Sorry, and I'm not the only person saying this. If you look around, you find political leaders saying it. Andy Burnham's been saying it a lot. Steve Rotherham in Liverpool's been saying it a lot. Councils, public health directors are all saying this kind of stuff through various different levels, and we need those different debates to try and pull it out. But there's a thing as well that people like ourselves will be realistic about. Even if we can get the local data to the local places, it doesn't mean it's going to solve stuff. There's going to be challenges there. So there's lots of people looking at modelling in local places. So there's a group in Durham who've been doing modelling in their place. There's a firm called Deck Zero who was producing and publishing local R models for quite a while. And some of that data has turned out actually not to be that useful, if even misleading. So I had a chat with Deck Zero. They stopped publishing the data because they could see it was being misleading and was damaging people and their own brand. So they pulled one of their dashboards and their data feeds because they see it was going wrong. We can see that the data, if we get some of this data out, it might cause harm. So, one of the famous cases is in South Korea, where data about where outbreaks were happening was linked to the gay nightclub scene. And South Korea can be quite a homophobic society, for those who did not know. And that's caused a backlash in that community. You can see some of the things happening if you look in France, in New Zealand, lots of other places have had some similar issues like that. So you need to think about and balance on those harms. And then will it actually do anything? So you talk to these places and they say, well, I might stick hand sanitizer in the lifts, I might put a public messaging campaign on, I might give more guidance and education, but we might find those things are actually unhelpful, or they just don't do anything at all. It's the classic case, is an analogy we use by government. You just pull the lever and the lever doesn't do anything, or it works in Leeds because people in Leeds do listen very carefully to their local authority, but it doesn't work in North Tyneside because we're a bit more rebellious and anarchist. So we've got to be convinced that we've got to work out how to do this well and not overpromise, I suppose, and be aware of the harmfulness of the harms. I'm also hearing concerns around funds. So some places have faced challenge in getting funding when they have managed to get access to data. Transparency, is this stuff, can we get this stuff, can we avoid some of the mistakes we're seeing at national government around the lack of transparency? Can we work there properly, persuade people to work in the open? And is there local capability? I suppose I'm actually less concerned about the local capability, because when I'm talking to places, it's astonishing how many people have crowded around local places to try to help out. So that's been a really good thing to see, but there can always be that capability challenge. So for me, I'm just wrapping up and then getting on to the next bit. It's about, so if we're getting started on this, and if you see my slides, I've got to evaluate, it is going to be about starting with a need and starting small. It's going to be about working in the open. It's going to be about demonstrating and being actually trustworthy with all of the rich characteristics of things around trustworthiness, honesty. And for me, on the trustworthiness, just go back to Baroness O'Neill. If anyone's not listened to her lectures on trustworthiness, at the moment we're in that place where we just need the foundational values of trustworthiness, honesty, competence, reliability. And then keep evaluating and iterating. So keep our eyes open, keep evaluating to work out, is what we're doing, is what's happening, doing what we expect, is it useful, what can we learn, and iterate with some fast feedback. But it comes from starting with that need. I say the one I'm getting most immediately, and where there's in at least one council who aren't on the call but might have been, they're certainly saying and that's a council which is linked to multiple councils in their area in the northeast, if there was data about either tests or symptoms at 3 or 4 digit postcode level, then they could start using that and forming some of these feedback loops very, very fast. So they'd be willing to work in the open, they're willing to do feedback loops. But starting quite small with that and looking at that local lockdown, that local relaxation, and stopping new outbreaks before they occur is something we could tackle reasonably fast if we could get either symptom data or testing data at 3 or 4 digit postcode level. One final thing, if this doesn't happen and we don't start getting the data from central government, places are starting to look elsewhere for other sources. It's not just building their own apps, it will also be sources from the private sector who are starting to offer proxies for testing and symptom data. So there's people out there in the private sector who are starting to say, we can see who's going to testing centres and we can see where they came from. We might be able to spot symptoms because of all of the silliness like web searches and things that we've seen happen before. So we can start seeing lower quality data unless we can get that good quality data that's already in the public sector to the local places who need it to hopefully try and save some more lives.